Hi, my name is Kelly Glidewell, and I'm in my second semester at Gonzaga University in the MSN Family Nurse Practitioner program. I'd like to start today by talking about my personal philosophies for healthcare and nursing. I graduated from the University of Washington with my bachelor's degree and have been a nurse for 24 years. I currently am providing hospice services in-home in Northeast Washington in a small rural area. My personal philosophy regarding nursing is truly to view individuals in a holistic manner. I find by taking the time to listen to clients' stories and history, I can better understand their current health issues and possible needs to improve their quality of life. I deal with many unique individuals in hospice care and from many different backgrounds and socioeconomic classes. I feel one of the most important aspects of nursing is not to judge clients and be able to address individual needs despite what might have brought them into my care in the first place. I feel the code of ethics for nursing states my practice philosophy well by stating, nurses establish relationships and deliver nursing services with respect for human needs and values without prejudice, transcending all individual differences. I need to remind myself of this code of ethics at times when it comes to hospice patients whose families are unwilling or unable to provide support to their dying family member. As a nurse, we cannot fully understand the dynamics or the history that might have limited the family's willingness to provide care. Instead, we must focus on the patient's needs and meeting their individual goals of care, along with supporting those family members and meeting their individual needs. The Code of Ethics also states a person's worth is not affected by their disease, and I would like to add not their circumstances either. As a nurse working in clients' home environments, I've witnessed the full gamut of lifestyles from the neat and clean middle-class household to the animal-infested shack with no running water or sewer. My philosophy as a nurse is that each human being deserves compassion and acceptance, honoring the way they choose to live their lives and being privileged to participate in their care in the environment they choose to live in. Autonomy of clients is an important aspect of nursing, and I feel as nurses we can build relationships with patients to help the healthcare team better understand and honor a patient's healthcare goals. Educating patients on their options of care is a key aspect to allowing clients to make informed healthcare decisions. If a patient is set on a particular path that might be against medical advice or my personal philosophy, it is my position as a nurse to take the time to listen to why that patient may be choosing that particular decision and make sure that they are fully aware of the pros and cons of their plan of care along with any alternatives. And then, despite what the patient picks, being there for them and supporting them through their decisions and making sure that their goals are being met. One other philosophy that's very important to me as a nurse is being reliable. This is a characteristic that I strive for to make sure that I follow up and follow through on all aspects of my patient care, be trustworthy and dependable for them, so when there is need, they know who to call and who will support them in their individual plan of care. Working with an interdisciplinary team is essential in patient plan of care, and my philosophy is that working together we can meet all the patient's needs. They have expertises that I do not, and when we come together we can encompass more of what the patient might need. I feel healthcare is evolving towards the interdisciplinary team and the holistic approach to patient care. Without examining and supporting all aspects of a patient's life, we cannot expect to meet the patient's needs. I feel as a future practitioner, my goals are going to be to support individual patients' plans and collaborate with other healthcare members to meet the emotional, physical, and spiritual needs of these patients. I feel that sometimes when patients come in and they're non-compliant with their medications, or they don't want to pick one therapy over another, a lot of times if you listen to their history and their story, you can find out the underlying cause and help solve those problems so they become more compliant and more participatory in their plan of care and their individual health. I am very passionate about advocating for the chronically ill, and helping them develop the plan of care that meets their needs and their goals to enhance their quality of life. I think patients need to be educated on their choices, especially at end of life and with chronic illness. Helping support them in those decisions will help cut costs for health care across the board if we're not doing unnecessary and unneeded testing to patients that don't want them done in the first place. So I guess my main philosophy for nursing would be to make sure that the patients are informed of their choices and honoring those choices, and working with an interdisciplinary team to make sure that those goals of care are being met for that patient. I'm looking forward to finishing my degree and getting into practice and helping the people in my community. Thank you.